When I was at the tender age of 1, my mom was diagnosed with brain cancer. She had a softball-sized tumor in her right frontal lobe and had to have part of her brain almost completely removed. This in turn drastically changed her personality as she was no longer really recognizable as the same person. A once on top of it nurse, a 4.0 student graduating top of her class at U of M, and a loving, dedicated mother turned into someone who could barely get out of bed, a complete 180 from who she originally was. In 2004, she had another surgery, removing the left frontal lobe due to malpractice from the first surgery, and the personality difference only worsened. Let's start off with a quick recap on the brain and how it is structured. The brain is composed of 3 separate parts: the forebrain, midbrain, and hindbrain. The forebrain includes the cerebrum, thalamus, hypothalamus, the midbrain, the tectum and tegentum, and the hindbrain, the cerebellum, pons, and medulla. The cerebrum, being the largest part of the brain, is what we will mainly be focusing on. Because it is so large, it is often divided into 4 parts or lobes. These are the frontal lobe, parietal lobe, occipital lobe, and temporal lobe. Each of these lobes have an extremely important job. The frontal is responsible for reasoning, planning, parts of speech, movement, emotions, and problem solving. The parietal is responsible for movement, orientation, recognition, perception of stimuli. The occipital is responsible for visual processing. And finally, the temporal is responsible for perception, recognition of auditory stimuli, memory, and speech. Now, it might seem slightly obvious that messing around with your brain would cause differences in personality, but how exactly does it change your personality, and why? Is each individual personality change predictable? Is it a zero-sum game? Let's start off with a procedure that is widely known for the changes in behavior that it has on its patients: lobotomies. A lobotomy is often defined as one of modern medicine's greatest mistakes. It often involved, and I'll save you the gruesome details, separating the frontal lobes from the other parts of your brain. Yeah, remember that thing? The one that controls emotion and basically your personality? But we'll get to that later. These gained fame as a way to treat mental illness via surgical procedures to make typically females more docile. While some reports indicate that it did exactly that, there were far more negative effects. It is quoted that the main long-term side effect was mental dullness. The patients that received them often lost their personalities and were unable to live on their own. But how do other medical, less controversial, needed procedures affect personality and behavior? In a study done, 66 patients that underwent brain surgery were tested to see how their personality changed. Both before and after their surgeries, they were given psychological assessment that test language, attention, executive function, memory, and perception. In almost all of these participants of the study, it was found that post-surgery they struggled with facial recognition, emotional recognition, and perceptual tasks, but mostly unaffected in the area of reasoning. But this isn't exactly answering why this happens, just showing that it is a known phenomenon. When removing tumors from the brain, it often just isn't the tumors being removed, but also the surrounding tissues. Imagine your phone and your charger cable. Your phone is needing to be charged, but your cable is sitting 2 feet away from you. Even though your charger is plugged in and has electricity running through it, it cannot charge your phone until it is connected. Your brain kind of works the same way. When part of your neural tissues are missing, the signals don't just stop firing. They continue to send signals to part of your body that no longer exist. This phenomenon also happens with some amputee patients, when the brain still feels the amputated limb, even though it might not exist anymore. It takes the brain a while to heal and to realize that those tissues no longer exist. The reason personality changes so drastically is an extremely complicated issue that is different for each individual person, but we can sum up some of the reasons here. First, when involving cancer, usually patients undergo chemotherapy or radiation therapy. Most of these treatments can make patients extremely fatigued, cause hair loss, weight loss, and pain. These alone can change one personality. The sheer psychological drama that process puts a person through can also change a personality. It can cause anxiety disorders, PTSD, aggression, memory loss, disorientation, and depression. But there is hope for these patients. Working with your doctors, psychologists, and therapists can help cope with all these issues.